Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hello again. I am the weight loss champion, Chuck Carroll. Thanks so very much for raising your health IQ with us. Today, we are going to be talking about a disease that affects 1 out of every 10 women in the country. Yet, despite the fact that there are so many women who are struggling with this, it often flies under the radar. We're talking about endometriosis. And to tell us a little bit about what it is and how you can treat it with diet, with lifestyle, how that can help, and then also share her own journey is Dr. Asha Subramanian. She is the founder of Dia Lifestyle and Wellness. Thank you so very much for being here again, Dr. Asha.
Thank you so much, Chuck. And thank you to the Exam Room Podcast listeners for having me here today.
We're thrilled that you are here today. And me personally, I should just put this disclaimer at the top of this episode that you are indeed one of my favorite people in the entire world because you're just so positive with everything. So I really hope that people can take away a lot of that energy today and come away from this educated with a raised health IQ, but also full of hope as well, because that's really what this boils down to today.
Yes, absolutely. Thank you.
Let's talk first about what endometriosis actually is. So, we're talking about 1 out of every 10 women will get it, unfortunately, in their lifetime. But what exactly are they getting?
So, endometriosis is an illness where the endometrium, or the inside lining of the uterus, rather than growing inside the uterus and being shed every month for unknown reasons, there are many theories behind it, but for unknown reasons, grows in other places. So, it may grow on the ovaries, it may grow in the fallopian tubes, it may grow actually in the lining of the abdominal cavity. And there have been cases where it's migrated to the lungs, the eye, and other organs. So that is the definition of endometriosis. It is a very, very painful condition in many women. And we'll talk about that in a few minutes, but it doesn't have to be painful. And the reason is because the lining is built up and then shed every month, but then this is happening outside the uterus. So there's nowhere for that menstrual flow essentially to go. And what happens is endometriosis can have effects on pain. So it can cause chronic pelvic pain. It can cause monthly menstrual pain in women. It can cause GI problems. So if it's in the abdominal cavity, it can cause diarrhea, constipation, bloating, abdominal pain. It can also cause infertility, which is a very unfortunate common side effect of endometriosis. And very quickly, there are many reasons why people think that women develop endometriosis. It does run in families. We find if mothers, grandmothers, or also on the paternal side, the father side, if somebody has endometriosis, you are at higher risk. There is also a theory about retrograde menstruation. So what that means is, for whatever reason, the cells from the monthly flow, they get released backwards, essentially, instead of coming out from the uterus and vaginal area. They go out through the fallopian tubes and out into the abdominal cavity that way. There is also a theory on immune dysfunction, so that folks with endometriosis, their immune systems are not recognizing the endometriosis, the tissue outside of the uterus, and their bodies are not fighting it and getting rid of it. So therefore, it's an immune dysfunction type issue. So there's really many different causes, and there's a lot of research going into this, but unfortunately not enough research, in my opinion, and not fast enough, because we have so many women suffering from this condition.
And the reason why you're here today is you were one of those women who was suffering from endometriosis. I had no idea that you had battled this until you sent me an email about a week or two ago. And you were like, look, I've never disclosed this publicly before, but I would love to come on the show to talk about my journey so that others who are currently struggling with this understand that there is a plan that can be put together that involves changing your diet, changing what you eat, changing your lifestyle, and then hopefully they can find a lot of relief from that. And
Mhm.
so let's give some inspiration there and talk about your journey. How old were you when you first noticed something was amiss?
So I started my periods when I was about 13 and a half. And Around that time, I had, got my period, and, as many teens experience, it's kind of like a shock. Whoa, like what's going on? And, I knew about it, but when it actually happens, but then quickly after, I noticed that my periods became painful. I started having menstrual cramps before my periods, and they seemed to be getting worse. And, I was kind of told, oh, all girls, all women go through this. And, mom went through this, grandma went through this, and take Advil or ibuprofen or, Tylenol, whatnot. And I did, and it helped, but the trajectory was not really going in the right direction. It was getting worse, not better.
So 13 and a half, that's right in there in that high school age range.
Yeah.
And so high school in itself is awkward enough, but then to put this on top of it, how much of a quality of life hit did you take because you were struggling so much every month?
I definitely noticed, like, on the few days before my period and during my period, I would get up a lot earlier because of the pain. I just couldn't sleep because the pain was so much until I had to take the next ibuprofen. And I was taking, by that time, 600, 800 milligrams at a time, which is on the higher end of dosing. And I would my flow was heavy, but not incredibly heavy, but definitely heavier, during the painful times. And that would impact me with sports and just social activities and such. It wasn't a great feeling to be in high school and having this monthly pain to look forward to, really. And it was always like, okay, I'm done with the pain, but in a couple weeks it's going to come back. And it was sort of something I resigned myself to, which is sad.
You mentioned that when you first started to get your period, it wasn't long thereafter that you noticed that things became painful. Did that pain intensify over the years?
It did. My pain did intensify, and I started finding that my kind of go-to treatment of Advil and or Motrin, ibuprofen, wasn't really working anymore. And when it really hit me was actually when I started medical school. So fast forward a couple years later, I'm in medical school. I'm supposed to be going to lectures and learning about histopathology and physiology and anatomy and all the things we learn in the beginning of medical school. And I found myself waking up with nausea and vomiting multiple times during the day and being buckled over in pain. And I couldn't go to class. So I sought medical help, of course, at that time.
Obviously, I've never been to medical school. I'm not a doctor, but I would imagine that being a med student in itself is extremely stressful. And then to be dealing with this on top of that, I mean, how much did that compound all of the stress that you were already under?
Looking back, it was incredibly stressful. In fact, I think about how did I make it through? I actually I think about that every day. And I actually ended up having to take a small leave of absence in between my second and third years because of pain, in part, that I was having, and these symptoms of endometriosis. And during that time, when I sought medical help, I was told that I likely have endometriosis. And by that time, I was about 25 years old, something like that, 24, 25, that I likely have endometriosis. But the only way to diagnose it, which is still to this day pretty much the gold standard of diagnosis, is something called a laparoscopy, where it is a surgery where you go under general anesthesia and the surgeon puts in cameras through small belly button and other incisions in your abdomen and looks around and has to visualize that you have endometriosis.
Well, that doesn't sound like much fun.
No, not at all.
So I'm assuming up till this point you were on the standard course of treatment, correct?
Yes. So pretty much what I was told is continue your ibuprofen therapy and start it 2, 3 days before your period rather than, waiting till those cramps hit. and go on oral contraceptives, which are birth control pills, essentially. And that would lighten your flow and make the pain better. And it did. I did that because I trusted my doctors, and I did that, and it did help, but it never took that baseline away. And I ended up actually having Chuck a laparoscopy while in medical school, which was very awkward because it was done by attendings and residents that I worked with on rotations, and then here they are having me as a patient. It was very awkward thinking back, but it was confirmed that I had stage 1 endometriosis, which is considered mild. There are 4 stages. So I was diagnosed in the middle of medical school with stage 1 endometriosis. And what I will never forget is the chief of OBGYN at my medical school looked at me, in the post-operative appointment and said, Asha, you have endometriosis. You need to have children as soon as possible.
Wow.
Now imagine being told that you need to have children as soon as possible when you're in the middle of medical school, you have no partner, you have no money, and it was like a ton of bricks falling on me, but
Yeah.
I kind of just said, well, I'm not in that position. I'm not going to run out and find the first first person here. And I just kind of said, okay, I'll continue the treatment because I was told to continue, the birth control pills and the Advil therapy, as I'll call it. And that was it. Nowhere was mentioned dietary change, lifestyle change, nothing else.
Yeah, boy, we're going to talk about diet in just a second. I assure you
Yeah.
that. But that is a heck of a bombshell to drop on somebody in their mid 20s in medical school,
Yes.
not seeing anybody, doesn't have a lot of money to their name, and you're like, time to have kids. It's like, whoa, pump the brakes on that. That is not part of the life plan that I had mapped out. Did that bring
Right.
a sense of panic to you? I mean, I assume that you wanted children.
Yes, so I did want to address that. So, I was somebody who always envisioned myself having children. I wanted children, and for that information to be dropped on me like that was, yes, it was panic inducing. I mean, again, I think back, and this is, of course, now many years later, and I think back, how did I even get through that period? How did I get through that? And I think I just took it one day at a time, which is something I still do. I still take things one day at a time. But I didn't know who to turn to. Like I really I didn't feel like my doctors really had a lot of knowledge. I'm in the middle of school. It was a tough place to be in.
That is a lot. That is a lot. But it also is proof that you are in fact Superwoman in disguise. The
Thank
fact that you were able to persevere. I mean, boy, I mean that's a heck of a story in itself. But there are many more layers to this onion to peel.
you. Yes.
So you mentioned that there was no discussion about diet or lifestyle with that initial diagnosis. I'm curious though, like what was your diet like up until this point?
Yeah, so I was probably what you call a convenient vegetarian. And by that I mean I would have, or even I would say semi-vegetarian. I was eating a lot of processed food. I was living in a dormitory style place. I couldn't really cook for myself. I didn't know how to cook for myself. I was eating a lot at the hospital. So hospital food, as you all know, is not very healthy, unfortunately. A lot of because I was trying to eat more vegetarian, I would eat a lot of cheese, a lot of dairy, a lot of processed food. I would have some chicken and turkey and other things at that time. So, I was trying my best, but it just was not a helpful food environment at all.
And when did you become a vegetarian? Was that something that popped on your radar very early in life?
Yeah, so my cultural tradition where I grow up, where I grew up from. So my parents are from India, so they um, it was very interesting. So they are first generation immigrants. So when they came to this country in the mid 60s, and then my mom in the early 70s, they tried to keep a more vegetarian tradition at home, but they encouraged my brother and myself, and I understand why, to want to be able to assimilate with American culture. And that meant, to my family, that meant eating at Denny's and Perkins and McDonald's and Burger King, and, being able to kind of hang with the American folks, in our community. So I grew up like that. So I did eat vegetarian food at home, for most part. But then when I went out, that's what I associate in my mind. When I went out, I had fast food essentially.
Yeah. Yeah. Well, I mean, it's so hard to eat healthy when you're eating out regardless.
Yeah.
So all right, let's pick up here. So you've just had that first surgery. They've told you now is the time to have kids, but you are still smack dab in the middle of medical school. So, you're trying to process all of this and still trying to move forward. And how did you move forward at that point?
I think and this may be in a very naive way, but I kept hope. Um, I said, I'm going to be hopeful. He said that, but I'm going to find somebody soon, and this is all going to work out. And I did get relief from the surgery for some years, actually, because what they do in the surgery is they visualize endometriosis and they essentially scrape it out, this extra tissue. Now the problem is microscopic cells still remain, but the tissue they scraped out, that is not shedding every month and not causing the pain. So I said, okay, I'm just going to kind of go with this and kind of get through. And I decided to go into family medicine. Family medicine for me was sort of the ultimate specialty. I could do a little of everything. I could work with families, a lot of psychosocial work, and also women's health, of course, which is an interest of mine. So I ended up, unfortunately, having 3 more surgeries after this initial one that I mentioned in detail.
Yeah. How long
And
was it before the pain returned after that initial surgery?
yeah, so I would say, thinking back, probably it was a couple years. It was a couple years. I stayed on the treatments that they recommended. I really didn't change any diet change. And then when I was a resident, it kind of continued the same hospital food. At that time, residents were doing 36-hour call, every fourth night. Um, there was even more stress in some ways. I enjoyed residency. I really learned a lot, and I was doing what I finally wanted to do. But, again, the dietary piece was not optimal. The exercise piece was non-existent, and unfortunately I ended up gaining some weight during, that time, which is believable because you're not exercising, you're not eating well. And the pain it was very insidious. It crept back slowly, crept back slowly, crept back slowly. And I ended up, like I said, having 3 more surgeries. So I've had 4 surgeries so far, all for the same condition. And actually, one of my ovaries was actually removed
Wow.
because it was infiltrated by endometriosis. And it was they said it's just doesn't work anymore. I mean, the ovary is the size of an almond, essentially. So, it's a very, very small organ, but it has obviously very important effects. And so that was taken out.
How old were you when that occurred?
Probably around like early 30s.
Okay.
Yeah.
Were you still in residency at that point, or had you moved past that?
I had moved past that. I had actually met somebody, and someone who I wanted to start a family with, and then quickly realized that this was not going anywhere. So, month after month, our journey to have a family, to build a family, was not going anywhere. And that opened up a whole other journey for me, which is infertility. So, as you said in the beginning of the segment, infertility is a very, very common effect of endometriosis. And, some women like me have pain, and other women don't even know they have endometriosis, but they find that they have infertility, and then they're diagnosed after that with endometriosis. And I do want to put out there that 1 in 8 families in the United States experiences infertility. So this is not uncommon. And I want to say this out loud. And the reason is because no one told me this. No one talked about this. It was sort of like a shameful thing, especially, 5 or 10 years ago, right? Or even before that. And I'm glad that people in the media are actually talking about this more, that celebrities are talking about this more. And I'm going to add my voice to this mix today as well.
I mean, there should not be any shame associated with that. I mean, there's plenty of pain that comes with it naturally,
Mhm.
and why add to that
Mhm.
with shame? Like it's not that person's fault, for goodness sakes. Um, I mean, you don't know what you don't know. And so
Yeah.
I understand also, though, as you were trying to conceive. I would imagine that you also maybe had some miscarriages along the way?
Yes. Unfortunately, I had several miscarriages. I some of them were further along than others, and really, again, I had excellent doctors, very caring doctors. They just said, well, it's the endometriosis. And again, going back to what we spoke about, there may be some kind of immune system effect that my body was rejecting these early pregnancies. And to go through all that, you're not alone. I want to tell your audience members, if they themselves, their family members, friends, you are not alone. you know talk about it with people, get it out there. And I'm glad to see that it's a little more common to speak of it now, because I felt so alone, I felt so isolated. And I'll tell you a story, Chuck. So, by this time I was a practicing family physician. I was in a very busy group practice. And I remember having, to go through infertility treatments and to go through, um, all the steps that takes. And literally to get a phone call that I was not pregnant, that it hadn't worked. And literally 10 minutes later, I had to step into a patient room, diagnose her pregnancy, and tell her that she was pregnant,
Mm.
while I had literally just been told a few minutes before that the nth time that I'm trying didn't work.
How do you even begin to compartmentalize that? I just can't even fathom having to have that type of conversation.
I think unfortunately medical training, prepared me for this, in the sense that you compartmentalize things. You are sort of, in a sense, you are numbed. You go through training and you compartmentalize things. You're like, okay, this patient, this is what's going on. Okay, let's let it not affect the next patient. And I'm not saying this is a good thing at all, but I think my medical training served me in that, on that day. And there was more than one day, Chuck, like that, unfortunately, um, where I got bad news, um, about myself, but yet had to go and take care of patients who had good news. And I want to celebrate that good news with them, and I want to be there for them. They are my patients, but to be undergoing that at the same time, I felt like I was in the twilight zone.
I just can't even wrap my head around those conversations. But here's also kind of what I'm wondering at this point is you have been practicing now for a number of years,
Mhm.
and you're still having the same struggles, and nobody, to the best of my knowledge, has even broached the idea of diet and lifestyle with you yet when it comes to endometriosis.
That's absolutely correct. Not one person brought this up, not the lead OBGYNs at the medical school, not my own doctors, as I went along in my journey, not one person. And I have to say, around 20 2012 or so is when, by that time, by 2012, I was vegetarian, but I was still having copious amounts of yogurt and dairy products, and I ate eggs and all of that. And I started researching because I was at a point where I was pretty desperate, and I knew that I'm not going to get answers from anyone. So I sort of decided I need to research, and I started researching, and then I saw there is a connection between endometriosis and diet. And by that time, I've been struggling with this for 10 years or more, and probably 15 years, really my whole life, I feel like. And I was so angry, Chuck. I was so
Mm.
angry. Like, why didn't anyone tell me this? But I immediately cut out. That's when I became a vegan. So I cut out eggs, I cut out dairy, I cut out, cheese and milk and all of that. And within, I would say, weeks, I felt better, considerably better.
Mm. Mm. That anger is understandable, no question about it. Was that also, though, kind of tempered by a sense of relief? Like, finally, Eureka! This is why now I get it.
Yeah. Yeah, it was. It was actually tempered by relief and also by hope.
Mm.
This was something that I could control. And I use that word in particular because I can say that, going through all of this as a medical professional, you often feel like, things are like, okay, if you study hard, you'll get a good grade on the test. If you pass all your exams, you'll get into the residency of your choice, or you'll get the job of your choice, if you work hard. And endometriosis, if you work hard, doesn't get better,
Mm.
and
Yeah.
same with infertility. You can work hard at it, but it doesn't get better. But this, changing your diet, did make it better, considerably better. And I did not look back. I did not look back. That's when, I became vegan. I then started exploring, more into lifestyle medicine, and that started me on my journey where I am today.
Oh, what a journey it is. So you said that it wasn't long before you started to notice, like, maybe things weren't as painful as they used to be.
Mhm.
Your symptoms were changing, you're feeling better. Um, were you then, so this hope that you were talking about, I would imagine then that you became a lot more optimistic, like, hey, maybe finally I will be able to conceive and carry to term.
Yeah, I had that hope. Um, I can tell you along the way, I was told that I would never have children, because my endometriosis was so severe. And I, to this day, credit my dietary and lifestyle changes with the birth of my daughter, who is now 7. So I am so happy to be a mother. It is the best thing ever. But I credit that dietary and lifestyle change and the work of PCRM and Dean Ornish and Neil Barnard and all the other giants, whose shoulders I stand upon today.
Boy, yeah. Boy, so 7-year-old daughter. I mean, tell me about the emotions of that day. Anytime that you welcome a child into the world, it's the greatest day of your life. But for you and your husband, I mean, it must have been even extra special.
Oh, it's like absolutely the greatest day of my life. Probably that day and the day I got into college. So, those those 2 days. But I have to say, for me, every step of my pregnancy, I was completely vegan. I was whole food, plant-based vegan, by then, and my pregnancy was the most uneventful, non-procedural pregnancy that you would ever have. I mean, people looked at me, my friends, my coworkers, they're like, "You're glowing. Dr. Asha, you're glowing." And you know, that I felt like I was on air the whole pregnancy. I mean, I had very little side effects like people talk about with pain and vomiting and feeling horrible. And, I carried my daughter to term. I had a normal delivery. Actually, I didn't exactly plan it this way, but she came so quickly that there was no intervention at all. So, I when I say that out loud, Chuck, because as you know, this is the first time I'm really talking about all this out loud. I mean, it was just such a perfect sort of capstone to this horrible journey, right? So
Yeah, yeah. And I mean, I hate to ask a woman her age, but how old were you when your daughter was born?
I was 40 years old.
All right, so let's let that fact sink in there. 40 years old having your first child after having suffered from endometriosis for the past roughly 27 years and having been told flat out you will never have children. And now here you are, 40 years old, welcoming your daughter into the world.
Mhm.
I mean, you said that you wanted to offer hope at the top of this segment. And if that doesn't offer hope and optimism and inspiration to those who are currently struggling with this, Dr. Asha, I'm not even sure what possibly could.
Thank you, Chuck. I must say, actually, I was 40. I was almost 41. A month later, I turned 41.
There
So
you go. Even better. Even
even
better.
better, even better. But yeah, my doctors during the pregnancy monitored me, of course, extremely carefully because unfortunately, if you're 35 or above, you're considered advanced maternal age in the OBGYN kind of venue. So, I was monitored very carefully. I continued, like I said, my vegan diet. I exercised throughout my whole pregnancy. I did weight training. I did walking. I did biking. I did aerobics. I did everything, and I felt so strong and fit even at the end. And starting where I was in pain and eating so poorly and fatigue and depression, frankly, to that day when she was born, just it's just tremendous to think about. It really is. Like, even it just blows me away right now talking about it.
Yeah, could you even imagine when you were having your darkest days and in such despair that you would have this radical health transformation and welcome a daughter into the world?
No, not at all. And I thank, of course, my doctors, and I thank all the research that's been done on all of this. But of course, I have to thank the higher power, so to speak, for all the blessings that he or she has given me to be able to be in this position. And I think about how today, I'm a board certified family physician. I'm also certified in lifestyle medicine. And I've gone through this journey, and I feel like, I've been placed here for a reason. I really do. I feel that way.
And it's understandable. And because you feel that calling, you're really working to help other people. And in addition to being a practicing physician, you have started DIA Health and Wellness, and I think that, or Lifestyle and Wellness. I'm sorry,
Mhm.
and it goes to the heart of everything that you and I have been talking about here today, and that is helping people,
Mhm.
overcome those health challenges. When you're working with somebody at DIA, what is that process like, and what kind of chronic diseases are you helping people with?
So when I work with someone through DIA, I really focus on the whole person. So often they come to me, they have multiple people have multiple medical conditions, like example, diabetes, high blood pressure. They might be overweight or have obesity, cholesterol. Sometimes arthritis, asthma, you name it. So many conditions. Folks are on so many medicines, and they are just not improving. It's kind of parallel to where I was at, Chuck. So, you're on the medicines, you're doing what the medical folks are telling you to do, but it's just not getting better. It's sort of the band aid solution, or it's just getting worse. and they want more information. What else can be done? And I want to be that health educator, that health coach, that cheerleader, that support, that sounding board, that person, that someone in this position who's faced with chronic illness, they can turn to me. We can work together to improve those conditions, to reverse those conditions in some cases, and to really improve their quality of life. And that's what I hope to accomplish with DIA. And
Yeah,
I
go.
started this in actually before the pandemic, great timing, but I started this business because that's not something I'm really given the opportunity with in my day job. So, in my day job, I'm a primary care physician. I love my patients. I love my work, but it's not the structure where I can really delve into the root causes of chronic illness and work one-on-one with patients. Although I do mention it, of course, in my daily work.
Of course, but I think that one of the cool parts here that I think that we need to stress here when we're talking about DIA is because you're not acting as a physician at DIA and you're acting as a health coach, that opens you up to be able to work with patients literally across the country. And so, if you're living in California, you're in Los Angeles right now, you're struggling with endometriosis, and you want to work with somebody who's been through that struggle. That is exactly why you are there, Dr. Asha. That is the cool part about this, right?
Yes. So I am, and I put it on my materials as well on my website. So I am not somebody's primary care physician. I am not managing medications per se or giving immunizations or that kind of thing. I am there to serve as a health coach, a diet and lifestyle educator, a person that has expertise in navigating the medical system. So I've had situations with clients, with patients where they weren't sure where to go next, and I've talked that through with them. I really am an advisor, really, with this expertise, and I can speak from the patient angle as well as the medical professional physician angle.
Yeah, it's you really do. You have it covered on all fronts. I'm gonna call you like the health Sherpa because you are that guide through what can be a treacherous field. Trying to navigate all the nuances of making sure that you get the proper treatment in the medical community. And I gotta ask you. I mean, I love your story so much, and what I know about you as a person is you are so positive and you are so driven to help the people who you are working with. I would imagine already, like, you're seeing some pretty good success.
Yes. So I have definitely seen successes in people reducing the amount of diabetes medications they're on. Their arthritis has gotten better. They've lost weight. They have improvements in asthma, in blood pressure. And of course, it's up to that particular person, that individual, to enact the changes that we talk about. But I have seen pretty much in every case some improvement from small, often very small lifestyle changes.
It's the little things that add up over time to make the biggest changes of all. It's
Absolutely.
I mean, do not discount those small steps. Don't don't
Mhm.
discount. I mean, that is the fatal flaw that I had when I was overweight. And I think a lot of people get tripped up like that is they're like, oh, taking the stairs, that will never make a difference for me.
Mhm.
It's like, yeah, it will, because it builds to that overall um healthier lifestyle. Like you
Mhm.
just kind of train yourself to do a bunch of those little things, and oh, it just makes such a difference, as you well know. So you know what else? Oh my goodness, I almost forgot to mention walk with the doc. So if
Yes.
you are living in the Washington D.C. area and you want to take a stroll with Dr.
Mhm.
Asha, you can do that as well. When and where are you doing these walks these days?
Yes, so we are doing the walks back in person. We are doing it in Wheaton, Maryland, at the beautiful Brookside Gardens, and we walk. We do wear masks per the county code. That may change, of course, with transmission of COVID and the infection rate going down. But we currently, we wear masks, we socially distance, but we walk in a group, and they have a beautiful paved trail called the Heart Smart Trail, which is about 1 mile around the gardens. And we walk all 4 seasons. We walk the third Saturday of every month at 11 a.m. So the next walk will be November 20th at 11 a.m. And if you want more information, it will be on, it's on my website, and I'm sure Chuck will let listeners know where they can find that.
Oh, I'll take care of them. Don't you worry
All
about
right.
that. I don't you worry about that. And that website, by the way, is Dia Lifestyle and Wellness, DIYA Lifestyle and Wellness.com is the place to go. Or you can click the link that is right now in the show description or the episode notes. I promise you it is a one click and you will not regret working with Dr. Asha. Dr. Asha, thank you so very much for being here and being so vulnerable and sharing your story and offering hope to those who feel hopeless right now, because I can guarantee you that that is exactly what you did today.
Thank you so much. I'm always so honored to be on the Exam Room podcast. And, this is something I've been thinking about a long time, to share my story. And this is the first time where I've publicly shared my story to, I don't know how many millions of listeners. So, I thank you, Chuck, for having me on your show. And I would love to hear from any listeners who are going through the same journey. I'm here for you. So if you just want to say hello, you can contact me on Twitter, on Facebook, direct email, phone, whatever works best.
We'll put all that contact info in the show
Mhm.
description as well. What is your Twitter handle in case somebody's wondering that right this second?
Sure. My Twitter handle is at Dr. Asha Sub, SUB.
There you go, at Dr. Asha Sub. And yes, indeed, with everything else that is in the show notes in the episode description as well. Dr. Asha, thank you so very much again for your time and sharing your story and bringing hope and inspiration and putting a smile on somebody's face who really needs it today. Thank you so very much.
Thank you, Chuck.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for the Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.